Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Lovenox, Pediatrics. Introduction. Lovenox, or enoxaparin, is a medicine that helps prevent blood clots from forming or getting larger in the blood vessels. Your child's healthcare provider may recommend Lovenox for your child. You may be asked to give your child injections of Lovenox to prevent harmful blood clots from forming. This program will teach you how to use Lovenox safely. It will also talk about signs you should look for when your child is being treated with Lovenox. Blood clots. When a person gets hurt, the wound bleeds. Blood has substances that help it to clot, causing the bleeding to stop. This clotting happens after skin injuries as well as after injuries inside the body. Sometimes the body forms clots inside the blood vessels. If a clot moves to a smaller blood vessel, it will block the flow of blood. The part of the body that is fed by the blocked blood vessel could die if blood flow is not restored. Blood clots can be harmful. They can cause a heart attack if they block a blood vessel in the heart, a stroke if they block a vessel in the brain, or difficulty breathing if they move to the lungs. Blood clots are more likely to form if a person is lying down in bed after surgery. They can also form because of other medical conditions. To prevent blood clots from happening, healthcare providers may prescribe medicines that thin the blood. The blood of children on such medicines takes longer to clot. These medicines are called blood thinner medicines. Lovenox is one type of blood thinning medicine. It is also called enoxaparin. Lovenox. Lovenox is given through an injection in the skin. You will inject the medicine in the fat layer under your child's skin. This is called a subcutaneous injection. Subcutaneous means under the skin. Your child's healthcare provider will tell you how much Lovenox to inject. This is called dosage. Follow the dosage prescribed by your child's healthcare provider. Do not miss a dose. If you do miss a dose, inject the dose as soon as you remember it. If it is almost time for the next dose, skip the missed dose and continue with your child's regular dosing schedule. Tell your child's healthcare provider if your child is allergic to heparin. Heparin is a substance similar to the medicine found in Lovenox. Tell your child's healthcare provider what prescription and non-prescription medicines your child is taking, including herbal supplements. Tell your child's healthcare provider if your child takes aspirin or other medicines with aspirin in them. Tell your child's healthcare provider if your child has ever had or now has kidney disease, an ulcer, an infection in the heart, a stroke, or a bleeding disorder.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Preparing the syringe. Lovenox may come in pre-filled syringes that have the exact amount of medicine prescribed for your child, or you may need to fill a syringe with medicine yourself. When you get your child's Lovenox syringes or medicine vial, check the medicine name and the dosage. You should also check the expiration date. Do not use the syringe or vial if it is expired. Look at the syringe before using it for cracks or leaks. Check that the color of the medicine is clear. Do not use the medicine if it is discolored or if it has particles. Store Lovenox at room temperature, which is between 59 degrees and 77 degrees Fahrenheit. You may wish to keep the original container in a clear storage bag or plastic container so it does not get wet, lost, or damaged. Keep out of reach of children and pets. You can store the vials for up to 28 days after the first use. If you need to fill the syringe with medicine, Follow the instructions in this section. First, wash your hands. The next section will teach you how to wash your hands the right way. Then, place the medicine vial, a new syringe, and an alcohol swab on a clean work surface. Roll the medicine vial between your hands to mix it. Do not shake it. Remove the cap from the needle. Pull on the plunger of the syringe to draw air into the syringe equal to the amount of medicine you will need. Use an alcohol swab to clean the rubber top on the medicine vial and wait for it to dry. It takes about 30 seconds to dry. Next, push the needle into the rubber top. Push the air inside the syringe into the vial. Next, turn the bottle upside down. Make sure the tip of the needle is in the solution. Pull the plunger down to draw the correct dose into the syringe. If there are air bubbles after filling the syringe to the right dose, you will not be injecting the right amount of Lovenox. With the needle still in the medicine vial, tap the side of the syringe gently so the bubbles float to the top, and then push on the plunger to get rid of the air bubbles. Next, pull the plunger down until you have measured out the right amount. Turn the bottle over so it is right side up and take out the needle. Be careful not to let the needle touch anything. Put the cap back on the needle and set it on a clean surface. Injection procedures. Your child's healthcare provider will teach you how to give your child the shot. The injection site will depend on your child's age and weight. Choose a room to give your child the shot. Pick a clean, uncluttered room with good lighting. Get the syringe with Lovenox in it along with an alcohol prep pad, a cotton ball, and a biohazardous waste sharps container to put the syringe in. Each time you give the shot, choose a different place on the abdomen, top of the thighs, or back of the upper arms. The body part you use will depend on the age and weight of the child. This is called rotating the sites. Wash your hands. Hand washing is the most basic thing you can do to prevent an infection. Wash your hands before and after the injection. Hand washing. 1. Wet hands and wrists under warm running water. 2. Apply liquid soap and lather well. If you use bar soap, keep it separate for your own use. Rinse the bar soap before and after you use it to remove the lather. 3. Scrub hands and wrists for at least 20 seconds. 4. Pay special attention to fingers, fingernails, and the back of your hands. 5. Rinse hands well with your hands up. This keeps the dirty water running away from your hands. 6. Dry your hands using a clean paper towel, starting with the hands and working down towards the elbows. 7. Use the paper towel to turn off the faucet. Remember, you turned it on with dirty hands. Have your child sit or lie in a comfortable position so you can easily see the area where you will be injecting the medicine. Ask your child's healthcare provider how to position your child. Clean the area you chose for the injection with the alcohol prep pad. Let the area dry. While the skin is drying, carefully remove the needle cap if you are using a pre-filled syringe by pulling it straight off. Throw away the cap in the sharps container. To keep the needle sterile after you have removed the cap, do not set it down or let it touch anything. If you are using pre-filled syringes, do not push out the air bubble from the syringe. It already has the right amount of medicine in it. Hold the syringe so the needle is pointing down. Do not touch the needle. Gently tap the side of the syringe so the air bubble goes up against the plunger. Now, hold the syringe in the hand that you write with. With your other hand, gently pinch an inch of the cleaned area of your child's skin in the recommended place to inject. Use your thumb and forefinger to make a fold in the skin. Be sure to hold the skin fold throughout the injection. Quickly put the needle into the skin fold like a dart, as far as it will go at a 90-degree angle. Slowly push down on the plunger with your finger until all the medicine is given. This will put the medicine in the fatty tissue. Be sure to hold the skin fold throughout the injection. Remove the needle quickly by pulling it straight out and let go of the skin fold. Point the needle down and away from your child. Push down on the plunger to activate the safety shield. You can use a cotton ball to gently wipe the injection site. The site may burn for a short time, and this is normal. To avoid bruising, do not rub the injection site after the injection. Place the syringe in a biohazardous waste sharps container. Your town or state may have laws about disposing of these objects. Check with a member of your child's healthcare team for specific instructions. If asked by your child's healthcare provider to keep a log, record the date, time, and site of the injection. Precautions. Lovenox will make your child's blood clot slowly. This means longer bleeding if they hurt themselves. Your child needs to be careful as they walk to avoid bumps and falls. Your child should not use knives or razors if they take Lovenox. Hard toothbrushes can also cause bleeding. Have your child use a soft toothbrush instead. Do not let your child play contact sports while taking Lovenox. Hits or falls can lead to dangerous internal bleeding. Examples of contact sports are boxing, football, hockey, wrestling. Ask your child's healthcare provider about any other sports your child would like to play. Tell all of your child's healthcare providers that your child is taking Lovenox. If your child needs to have epidural anesthesia, spinal anesthesia, or a spinal puncture while taking Lovenox, they are at risk of collecting blood in the spinal column, which could cause paralysis. Do not give your child aspirin or any products with aspirin in them while on Lovenox. If your child is taking low-dose aspirin, talk with your child's healthcare provider to learn if they should keep taking it while on Lovenox. Tell your child's healthcare provider about any medicine, prescription, and non-prescription that your child is taking. Do not miss any scheduled medical appointments or laboratory tests your child has. When to call your child's healthcare provider. Some side effects of Lovenox are normal and others are serious and need medical attention. Normal side effects are minor bruises or small amounts of blood at the injection site. Serious side effects are rare but can still happen. Severe bleeding should be reported to your child's healthcare provider right away. Signs of bleeding are unexplained bruising, black or bloody stools, bowel movements, blood in your child's urine, pee, or vomit, throw up, blood that comes up when your child coughs, nosebleeds, swollen ankles or feet. Allergic reactions should be reported. Signs of an allergic reaction are rash, hives, and itching. Hives are red, raised areas of the skin. Infections should be reported right away. Signs of infection at the injection site are fever or chills, irritation or burning at the site of injection, redness or swelling at the injection site, pain, skin that is warm to the touch, drainage. If your child has a serious fall or hits their head, report it to your child's healthcare provider. Your child will need to be monitored for internal bleeding if they have such accidents. Report any other abnormal signs your child experiences, such as chest pain, shortness of breath, or irregular heartbeat. If you think it is an emergency, take your child to the nearest healthcare facility or call 911.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Lovenox, or enoxaparin, is a medicine that helps prevent blood clots from forming or getting larger in the blood vessels. Blood clots can be harmful. They can cause a heart attack if they block a blood vessel in the heart, a stroke if they block a vessel in the brain, or difficulty breathing if they move to the lungs. Lovenox is given through an injection in the skin. You will inject the medicine in the fat layer under your child's skin. This is called a subcutaneous injection. Subcutaneous means under the skin. Your child's healthcare provider will tell you how much Lovenox you should inject. This is called dosage. Follow the dosage prescribed by your child's healthcare provider. Do not miss a dose. If you do miss a dose, inject it as soon as you remember it. But if it is almost time for the next dose, skip the missed dose and continue with your child's regular dosing schedule. Lovenox may come in pre-filled syringes that have the exact amount of medicine prescribed for your child, or you may need to fill a syringe with medicine yourself. Your child's healthcare provider will teach you how to give your child the shot. Some side effects of Lovenox are normal and others are serious and need medical attention. Minor bruises or small amounts of blood at the injection site are normal side effects. Serious side effects are rare but can still happen. Thank you for using Explain.